very pleased that you've decided to give us a talk. The talk on my piece of paper says it's about health in medieval London. I'm interested to see if you think any better than what you get.
Is my audience going?
No, don't change the
It might be any moment now.
Can't see the screen.
I think he's changed the seat to here, that's okay.
Can't see through the back of my head. Sorry, guys.
I'm going to do a small song.
What?
To start off with,
A song?
a song, yes. A
I
song.
am going.
Here goes. Ring of roses, a pocket full of posies, a tissue, all round. All knew that, was it?
The play.
That's what we're going to talk about today. I had in fact pictures. Unfortunately, due to the vagaries of technology, I can't do that. We might be doing it next week, who knows, but I wouldn't back on it if I were you. Okay. I'm looking mainly at my favourite subject, which is London. Well, please, if you can't understand or hear what I'm saying, just tell me, and I'll go into even higher load of voice. But it depends entirely on you. Okay? Do you want to go now? Any more?
No, you're on my good side, it's okay.
Stay on a chair.
Okay. We're concerned then with plague, we're concerned with London. The first recorded plague in London was, as you probably know, in 664. The Venerable Bede says, who would in fact again say the Venerable Bede? You know who the Venerable Bede was?
Yeah.
Good. I'm very impressed.
Yes.
Alright. He says it depopulated southeast England. And that would include London too. One of the great things about the medieval period is the number of diseases and accidents and things that happen to you. We're jolly lucky to last off for about a week, I suppose. Anyway, further plague came shortly afterwards in 660, and just after the founding of Barking Abbey. That could be a warning to us. You know who the occupants of Barking Abbey were?
The Abbess.
Go on.
No idea.
I did hear something just then. An abbess? Did you say abbess?
Yeah.
The Abbess.
Good. That means the membership of the abbey were monks. Good. Now, that's, I'm very pleased to hear that. It's yes, I'm surprised if I may say. Very nice. Anyway, the next maid, in fact, turned up at Barking Abbey, and he basically killed the lot. Whether that's a retribution by God, because they were all females, and including the abbess, who was a member of the House of Lords, shocking, isn't it? Absolutely shocking. Now, another concern that was worrying the people of the time is the problem of leprosy. Leprosy, as you know, is a rather unpleasant disease which will lead to gradual wasting of all your limbs. I think it still is about, but not much. But try and avoid it if you can. Leprosy became a great problem, particularly in London, led to the founding of leper hospitals. There was a leper hospital at St Giles's in the Fields. You'll undoubtedly come across St Giles in the Fields at the beginning of the 11th century, when it housed 40 lepers. The leper hospital at St James, that's in the 11th century. However, by 1346, lepers were excluded from London. There was in fact a tendency amongst the ruling class in London, if they didn't like a particular people or persons, they'd exclude them. That was it. So I advise you not to get a touch of leprosy if you're going around London. So they excluded. By the reign of Henry VIII, there were several leper hospitals in London, but in fact most were used for syphilitic persons. So here we're getting to another low level. I apologise for this, but that's the nature of the game. And so if you were syphilitic, then you would go to that hospital. Now there's more problems of syphilis than there was by that time with leprosy. Interesting. In 1258, there was a major plague, which was linked to London, but it didn't get very far. There are food shortages with high prices, and even the Bishop of London, he died of
Syphilis.
It's a possibility. It's a possibility in the sense that if you had one of these events, you were somewhat weaker character.
What did he die of?
He died of famine. He didn't. He died of it. So as there were food shortages, the prices of food went up, and the poor had it. At least they had a bit of money, but mostly they wouldn't be poor if they had money. So we go on to the 1300s. Then plague broke out. It was very similar to the Black Death, which would come later on. This is in 1361. In 1433, there's another bout of plague in London called the Great Pestilence, and a large number of people who were in London died. London was always going to be the likely place for big diseases and things like that, because everybody seems to go to London. London is a place where you can get a lot of money, where you can make money, so you go there, but you can also die there as well. There were fugitive plagues from similar to the Black Death occurred. In 1407, for example, 3,000 people died of a form of plague, and Henry the Sixth sent off all the plague people to Essex. That was a place, the safety of them, besides which who went from Essex anyway.
They're called townies now.
The 1517 plague was a compound nature of the sweating sickness. You get the sweats, and you can't get in the sweats, and on and on and on until you just die of lack of moisture. And in fact, the government so disliked sweating sickness, they all went off to the country, to Reading, in fact, my hometown. I think in fact they went off to Reading Abbey myself, but I haven't been able to find any note of that. London was deserted, especially around the Inns of Court. And it says something about lawyers, that there were none there. It doesn't mean to say that lawyers in fact haven't got any spine or backbone to deal with this kind of thing. And also they can see their money's going to kill fewer and fewer, therefore why bother? It's all downhill.
Any questions?
No, well, we'll get later on, yes, for sure. Oh yes, disease continued to the 1548, and when the king instructed that anybody who had the fever or any similar horrid disease would have to put a blue mark in front of their doors, so you would know not to go anywhere near them.
Your door's painted blue.
Did that later on. Towards the end of the 16th century, attempts were made to improve the records of the populace, because the government suddenly decided they didn't know how many people there were in England. So they decided, in fact, that the churches should have a directory of every birth and every death in the parish. And that's when it started. We still have that, of course, going on today. In 1603, 1603, London was affected by an acute plague, where only a mere 2,798 died in 1 week alone in the city. In 603, London was affected by a plague so acute that he's put in his papers down.
It was so cute, you forgot to write about it.
Right.
My father is like that, Dick.
Yes, I'm sorry about that. The trouble is, I was going to give you electronic, a wizard of pictures and all that today. Unfortunately, new technology is done for us, so I couldn't show it.
Have you got the pictures from the 1330s then?
I have got pictures, in fact, from the 12th century, if you wish, yes.
You could lend him yours, Ross.
Cameras are right.
Well, of course I haven't got them with me at the moment, but nevertheless they're there. The Black Death, of course, is the one we really want to see and hear about. This is also known as the bubonic plague. It started, in fact, in Europe in the 14th century, probably in fact farther than that. And it raged in England from 1347 to 1350. It reached London on the 29th of September 1348, and it struck in a widespread way. The city was virtually derelict, no one was there, there, if you couldn't get out, you were finished. And one interesting thing is, of course, that the majority of these plagues began usually in fairly poor housing areas. So the poor were the first, as usual, to get it. And when they died, of course, it helped reduce the disease. So you've got here, when you've got narrow, busy streets, we've got crowded houses, where you've got no idea of sanitation at all. As you know, you would get rid of your excreta, something like that, and just chuck it out the window.
Don't we do that now?
And they used to shout, this is what this, they used to shout, "Gardy loo." Because you're just about to throw the loo, release the contents of the loo out the window. So try to avoid those houses if you can. There's a recurrence of the plague in 1665, which was the worst time. It killed half of the population of England. And of course London copped it worst of all. When the disease spread rapidly, it went mostly, in fact, to very tightly packed urban area, and London is the case. So poor London always gets the teeth from that. In 1510, there were no plagues in London. They must have been wondering what had happened. And London, in fact, had a 15-year immunity before the next real outbreak, which was in the summer of 1625. And that's the one we mostly hear of, and Pepys was also involved, but didn't catch it in it. And it was the last time, really, that the plague occurred. It's a very peculiar thing. Could the plague occur again? I think it is not impossible. It'd be very interesting to see how any government would deal with the situation then. I think they think that sometimes during the war that perhaps on either side there's a possibility of just allowing certain bombs with certain inhabitants to go into their space. They didn't do it in the end, but they did think about it. I'm sure if you're dealing with the war to end all wars, you have to do something to end them quickly. And that's really in the end. By the 17th century, that Black Death and more is gone. but other diseases came later on, but not at the same level. That was the real big O to get, but not to get. Okay, well, if you, I'm hoping sometimes to get my pictures allowed, but I'm not too certain whether that'll happen. It's taken about half an hour today.
Very good.
But
If you do, it'll be part 2.
it will be part 2. Part 2, yes. Okay, well, that's enough for today, ladies and gentlemen. Are there any questions you'd like to have? I can't say I'll answer them, but I'll say listen.
Has it actually been proven that most of these Black Death outbreaks were from rats?
Yes.
And then the supposition...
There's been a debate on that system, whether the black rat was the main cause of the disease.
Wasn't it the fleas that they carry? It was the fleas that they carry.
Yes. Fleas that, oh yes, the fleas that does help a lot. It was the fleas as well. In fact,
Stop scratching, please.
yes, it was the black rat. Although the things that spread out from the black rat, fleas we hear talk about, they're easy dancing from person or animal to animal.
So possibly, if it was from the black rats, that the Great Fire may have had a hand in expunging that. Is that right?
Yeah, indeed. I think that's highly likely. So out of bad can come real good, and that was a real good because there's never been a plague like Black Death we've had before. There have been times when the governments and various make-ups have been worried, but it's never actually come out to anything really serious. It doesn't mean to say it can't happen. If you've got something, if you get something which is really difficult to deal with, and the medicos are not quick enough on the spot and don't tackle it quick enough, then we could all be problems. But hopefully we won't be.
Subhash, you have a question?
Thank you very much, Mr. President. I'm just inquiring about this, what you call the plague. Wasn't it that when we had the Great Fire of London, that there was a spread of plague which was wiped out by the fire? Is that right?
I just said that.
Yes, it is highly likely that the Great Fire of London did actually help the demise of disease.
Yes, to finish the disease.
Particularly things like the Black Death. It did not occur in London again. There were various things in Victorian times which were pretty bad given the sewage situation, but we never had anything, we've not had anything like the Black Death since the Great Fire of London.
Thank you.
Yes,
How are you defining plague and pestilence?
How do I define plague and pestilence?
Can I just explain the reason for the question? You said that whenever it is you said, that just about wraps up when London, etc., had plagues and pestilence. But there was a huge, great dying off of people early in the 20th century from something called flu. And therefore, in a sense, there was a many people in the early 20th century dying of that particular epidemic as there were of the plagues. And therefore, in a sense, you can't say plagues and pestilence is finished, because
he didn't say that.
But we don't define the flu epidemics as plague and pestilence.
There was a fire of London after the flu.
Sorry?
If there was a fire of London after the flu, maybe it would have been wiped up too.
No, well, it may have been.
So, I didn't catch that point. What about the fire of London?
He said if there was a fire in London in the 20th century, it might have worked it out as well. But it seems to me that the idea that plagues and pestilences no longer seem to occur when we actually had something virtually the same only, well, literally about 100 years ago.
What were the problems that children used to get by bathing in swimming pools in the 1940s?
Polio.
Now, there appeared to be an epidemic of polio.
Yeah.
And it's died away for whatever reasons. So, and also, if you go back even farther, the time I've gone back, there were absolute times of no food or anything, and people died by the thousands. In the middle of the Middle Age, around about the 12th or 13th century, there was a huge death rate, bigger I think than any other time that we've had in this country. And it had a profound effect on England, it had a profound effect on agriculture. It brought about the tenants revolt, what are they called? The revolt of the workers, the serfs. Yes, the serfs. And in fact, as a result of that, the wages for serfs and other agricultural workers went up. So there was this tremendous death of people particularly in East Anglia. I've not seen any comment as to why that happened, but it did happen. And I would have shown you a statistic about it, but I can't because the person is
What Ken was talking about, the flu epidemic of the 1920s, I suppose, after the First World War.
Flu, yes.
That would really be classed as a plague because it was worldwide, wasn't it?
Yeah, certainly in terms of the death rate, probably it was
20
the
million
last
or something,
plague
wasn't it?
perhaps have had. All that goes to show, I hope, is what I've said earlier. You cannot say we are not going to get a plague again. Human beings and all the little animals and things that they have with them, insects and such, will bring problems to us of a health nature. So it's really waiting and seeing as to when the next one will be.
Cheer me up, Dick.
Yes. In fact, one case of bubonic plague was reported in China this week.
Here's one there.
There you are.
The town where it occurred has been closed off.
Yes. Well, I asked
As a
for the
precaution.
support because I knew I was going to get
Good
this talk, so I wanted this to be known.
Well,
Any more questions?
there probably won't be another bubonic plague because the atom bomb will wipe us all out.
Oh, even more cheer.
Only cheerful half hour, isn't it? Sorry.
Richard, what an interesting topic. On the face of it, it looked rather, but the way you've explained it and the way you've opened up people with other ideas and thoughts and it's brought people interaction,
Yes.
that's the right word, fascinating.
Right.
I've written down here, plague, pestilence and poverty, social inequality. Are we sure you're talking about medieval times?
Yes.
That's right then.
And there's many good times. And also knowing your place.
I found it very interesting, and the reaction, but I think we've had more reaction from fellows than most other talks we've had. So, could we express our thanks to Richard for his...
Just one more thing.
Sorry, mate.
Come on then, just this one.
When are you going to do the next London Walk?
When the plague comes.
I can't tell you that, but I can tell you that I am working on ideas for it.
Good.
So there will be one, though not immediately. Probably, hopefully during this year, but possibly later this year, perhaps early next. I shall be doing something.
Make it this year, I haven't got long to go.
Richard, let us draw the raffle, please.
No, yes or no, Dick?
It's a definite maybe. Who's going to get a cup of tea?
Yes, Julia will be very pleased.
I'm sure she will.
Thanks very much.
Thank you.